And then I'm going to share my screen. Let me know, make sure you can see. You should see that says menstrual cycle, is that correct? Can y'all see that?
Yes.
Okay, beautiful. Okay. So this is where we left off. I posted that video in Teams. So I told you this is one of the ones I wanted to watch. I might have to turn off that sound if it doesn't stop. And that video went over and it talked about the menstrual phases from the first phase to starting with the menstrual and ending with the luteal phases. That's why I posted the video because, let me turn off notifications. Hold on 1 second. It said 1 year. All right, can y'all see back to my my lecture? Make sure I got to the right screen. Somebody let me know before I can. I don't want to go on and y'all don't see it.
We're seeing it.
Okay, cool. All right.
I can see it.
All right, thank you. Okay, so if you didn't watch that video, make sure you go back and watch the video, okay? One of the things, because it talks about the cycle, and it's really interesting because a lot of times women, you know, we have menstrual cycles and we don't think about, oh, we don't really actually know how it works. And, you know, as far as that, it's an ongoing, constant process. It's not something that's just, oh, once a month. That's what we kind of think, but it's not. It's a constant thing. And we learned that the uterus itself houses the placenta and the fetus if a egg has become fertilized. And it does that, what I call the baby bed, the lining. But at that lining, and there's no egg that's fertilized, and there's no egg that needs to be implanted into that lining is shed or sloughed off, and that's the bleeding that occurs each month. All right? Usually, blood loss is 10 mLs to 80 mLs. And we're going to be honest here, ladies. There have been times that I've thought I was dying, because if you've ever had heavy periods, or somebody, you know, somebody who suffered with it, you're like, this can't be normal. This just can't be right. And it's sometimes, it seems like an extreme amount of blood loss. But you have to remember that one drop of blood in the toilet can turn an entire toilet pink red. So it's strange how that works. With your menstrual cycle, women can experience abdominal cramps, and that's usually that myometrium, the muscle of the uterus, that's contracting to expel the lining. And then the video talked about the follicular phase, and then this is the phase with the menstrual cycle that the pituitary gland and all of the hormones start happening. So when you think about that, this is the hormonal portion, okay? And rest of it, I'm not too worried that, you know all of the every, detail involved in it. Just know that the follicular phase, this is where the hormones are begin to secrete. It stimulates the egg production. And then the ovulation, this is that the pituitary gland has now caused that egg or the ova to release a ready, mature egg. So, and then we are talking about how the fimbriae kind of, once the ovary releases it, the fimbriae are like the little tiny finger-like projections, and they swoop that egg and, bring it into the fallopian tube. And it travels along the fallopian tube. And that's during that time that pregnation, you can become pregnant. And that's the time that if there's going to be a pregnancy, is while that egg's making its journey. And then like I said, the last, the luteal, the sperm doesn't impregnate. Then that's when the hormone will be released to say, hey, there's no baby, there's no need for a baby bed, shed this off. And we begin our cycle. And then it starts all over again. So next we're going to talk about pregnancy. And a lot of the first thing I tell everybody, pregnancy is not 9 months, it's 10 months. It is 40 weeks. And everybody's like, what? But yeah, it is. Pregnancy is 40 weeks. And pregnancy begins from conception to birth. This is what they medically define pregnancy. When the egg is fertilized by sperm and then implanted into the uterus. All right? And sometimes you'll see women who will still have a period. This is, pardon me, it's not uncommon, and it doesn't necessarily mean that there's anything wrong with the pregnancy. It just means that the hormones haven't caught up to the fact. And we know that our pregnancy is divided into something we call trimesters, and there are 3 of those. And they each last about 3 months long. So what's the cause of pregnancy? Well, that's called sex. And usually if you have unprotected sex, you have a higher chance of becoming pregnant. So what are the symptoms of pregnancy? Sometimes a woman will miss her period. Sometimes she'll have spotty bleeding, sensitive breast, nausea, even possibly vomiting. And what's happening here is you're having those hormones that we talked about last lecture fluctuating and changing. And now a new hormone being introduced, that HCG, that's a pregnancy hormone. And so everything's, on a hormone-wise, is on a roller coaster. And so especially in the mornings, or if you try to eat or something like that, you might experience more nausea because there's a higher influx of or fluctuation of the hormones during this time. And I know something that we can tell our patients is keep something like crackers and water, something small, and eat a few times, when you first wake up, just to kind of keep nausea at bay. The first month of pregnancy is the embryo is about a third of an inch, so it's tiny, it's minute. And so, but the thing you need to know and write down about first month is at the end of the first month, there's a heartbeat. So right about 4 weeks is when you have a heartbeat. So that's the first month. The second month, this is when a lot of things really start happening, okay? We're getting a heart pumping, we got nervous system and a spinal cord forming, arms and legs are beginning to bud, and the facial features are even beginning to form, okay? So the second month is a real spike in growth, okay? The third month, this is when we go in, you can usually get a good picture of your baby and it not look just like sort of like a jelly bean. This is when we start to see a more human type of appearance, and we can see fingers and toes. And the kidney, we'll be able to view the kidneys, and all four chambers of the heart are now complete by the 3rd month. The 4th month, this is when you start, you could possibly feel kicks and flutters and stuff like that, because the baby's moving and it begins to kick, it can swallow. It says most women can't feel their baby move, but every woman I've talked to says they felt fluttering. They felt their baby right around here. Not everybody, but most of them. Your fetus at this 4th month can hear, can urinate. It has sleep cycles. All of its organs are formed. And now all it is time for it to chill in the easy bake mama. And that's the rest of its job. Okay? So after everything's complete by the 4th month, now it just needs to get grown and bigger and stronger. By the 5th month, we usually have about a pound. Rapid growing begins to occur at right around the 5th month. This is the point that if you didn't feel movement, then the doctor might be worried. And the doctors can say, oh, you can hear your heartbeat, the baby's heartbeat with a stethoscope. I never could. And I had a $300 stethoscope, and I still never could hear it. The only way and it's probably because, adipose fat tissue, but I didn't never hear either one of mine. But the old-fashioned days, this is what they'd be listening for. At the 6th month, the lungs are not fully developed. But with our technology that we have right now, we have the capability, if a baby is born at this time, even though it's about a pound, maybe not even a full pound, we can keep a baby alive. We have we have the technology. But when a baby comes out this early, I know I said earlier everything was grown. I mean, like everything but the lungs, because the lungs are the very last. They're formed, but they're not completely budded. Think about them like a tree. So you have the branch and the roots and everything, but we need all of the tiny leaves to open and bud. And that doesn't occur till the very end of pregnancy, if that makes more sense. All right? So when a baby's born and the ovuli and the air sacs of the lungs aren't completely budded and grown, then a baby is going to need respiratory assistance. And so intensive care, and that's where they go into NICU, our neonatal intensive care unit. All right? But usually most women can go their pregnancy and not have difficulties and stuff. The 7th month, there's even a higher chance of survival. We have a baby that's about 3 pounds. The baby starts sucking its thumb, looking around, and becomes very alert. The 8th month, the baby begins, this is what you need to write down for the 8th month, is this the key part. By the end of the 8th month, that baby needs to turn. If the baby has not turned, by meaning like head down, then we might be concerned. The doctor might be concerned and might say, okay, let's try to position some. I've seen them, if you've ever seen videos of them repositioning a woman's stomach trying to get a baby to turn, it's crazy. Google it. But the other thing that they can do is if it just baby won't turn and they can't manipulate it, then they can schedule a C-section. Because you don't, and some doctors will say, well, we can try breech. But that's what that occurs. If the baby's not head down and they're facing sideways or legs down, that's a breech birth. And you can imagine that's going to be hard to, push out. Can it happen? Absolutely, it happens, but it's just much easier on mom and baby when we go into head down position. At 9 months, so we want the baby to full 9 months. So we should be somewhere between at the end of 9 months, so right at 40 weeks, we should be 6 to 9 pounds for the baby's weight. Some of us have smaller babies and some of us have bigger babies. And they should be anywhere from 18 to 20 inches in length. All right? And that differs from woman to woman. And one of the things about the 9th month, what you want to write down as far as a note, is that this is when the baby drops. Now, some women really don't notice it, a big difference, but then the other women, you're just like, whoa, she was way up here and now the baby's way down here because the baby's getting ready. It's ready for birth. And then you get a picture, and this baby obviously still hasn't rotated and turned into the birthing position, but you can see, and I have a really neat picture that I'll post, and it shows how our organs are smashed and just literally completely shoved out of place to make room for a baby while we're pregnant. It's amazing what we're able to do. It's amazing that we're able to pass a baby through, like I said, that the uterus stretches that big, and that the cervix and the vagina can open to that. If y'all saw my son, he's sitting here in front of me. I wish y'all could see it, and he's going, making like expressions. So, but the good news, ladies, is that, like I mentioned before, stop. What the good news is before is that is elastic and muscular, and it does go back to its original shape and size. Sorry. Stop, Brian. This is showing you if we were looking at fetal development. And this is really pretty. You got a little jelly bean right here. Until looking as we start going our alien babies, as I like to call them. And then this is more babies, where we're starting to really see distinct features. What else are we seeing? They are running out of room. And this 8th month, if you look, they're kind of trying to show that he's or she's turning. And by, like I said, by here, we should be head down. We already talked about that. Okay, now dilation. So there's different phases of labor. And latent labor is very confusing. And usually when you have your first baby, latent or phase 1 can happen sometimes a week to 2 weeks before the actual birth. And we start noticing that the cervix, what they call it, efface. It means it thins out, and that it's preparing for birth. And you might start having some mock contractions. We call those Braxton Hicks contractions, but they're not the actual real deal. And a lot of women, it's very confusing for their first time having, or sometimes even second and third baby, because they feel pretty real. This basically goes over and tells you about the signs and symptoms that somebody might have during that. But we don't actually begin to think of, okay, it's time to prepare for a baby. It's time to actually think about delivery until usually a few things happen. The mucus plug is lost. Now, some women lose their mucus plug within a week before delivery, and then some are right before delivery. But when whenever the amniotic sac or their water breaks, this is usually a time that we call active labor. So it's moved to the next stage. Now, sometimes women's water just don't break, and the doctor will have to, pop it and help speed up and induce the process of labor. And then the active labor, and it says it lasts from 2 to 3 hours, and there is a wide range there. But basically, what ends up happening is where your cervix is usually at a 0. During the first phase, it can open or dilate up to a 3. By the second phase, you start dilating and the cervix is open up to a 7. By then, we're hopefully in the hospital, or if you're delivering at home, the midwife's there, that kind of thing. How do you know if you're in active labor? They start telling you to measure the contractions. And this explains that anything that's lasting 40 to 60 seconds with peaks and then lows, and it's coming regularly, that means that, your body's getting ready. It's baby time. The pain begins to increase. Backache, leg ache, fatigue. And then at this point, when the contractions occur, if the amniotic sac hasn't ruptured, they'll go ahead and rupture it. And then the third phase is called transitional, or the advanced labor. And during this time, we've gone from starting at the cervix of 0, but now we're at a 10 centimeter. So that means we're ready. And so this is the shortest part of labor, and usually it's about 15 minutes to an hour. I see my little parentheses. I've heard of some women this being like a 3-hour thing for them. At once they're at 10 and it's still push. So it's different for every single woman. But that's why they monitor the baby, they monitor the mom, and they check. And if things aren't, like with me, I was in labor from the start to the end, 32 hours. And I never dilated past a 3. So they had to do a C-section for my baby. And then Brian was C-section as well. So good thing, because Sarah was 9'4", and Brian was 8'6". So big babies. So we want, during this phase, this is where, they're telling her to go ahead and push. They're telling her to make sure she remembers her breathing. And this is the part where the doctor is readily in there, and this is the, active, advanced stage where, it's showtime, right? Baby's coming. And then this is just more signs and symptoms. And then next is, what I want to talk about real quick is a C-section or cesarean. That's what the C stands for, is cesarean. You should know that. And basically, like I said, in my case, I didn't dilate. There was whatever reason, it just would not progress like it should. So they had to make a surgical incision. And that's what a C-section is. So because we needed to get the baby out, and so that's how we did it. There's a real nasty stigmatism running around, and a lot of women encourage to say, oh, if you didn't deliver naturally, you didn't have, you're not a real mom, or this or that. And don't let people tell you that. If you have a C-section, you still delivered a baby. You made it, you baked it, you brought it to life, okay? You're still the same mother as somebody who delivered it vaginally. C-sections can be planned, like mine with Brian, the second one. He was planned because most doctors because of the risk of complications. If you've had one C-section, they'll want you to continue to have a C-section because they do not want to do vaginal birth after cesarean or VBAC. Now I say that, but sure enough, one of my girls in my first class when I get here to Florida, I was like, well, she's like, I had a C-section, but I was like, oh, well, they'll make you do another one. Her doctor had no problem with it. So maybe because she was younger and just, he just felt that it was okay and it wasn't a risk. But a lot of doctors are very unwilling to do a vaginal birth after cesarean because there's chances of the placenta ripping away. There's just chances of complications. So usually if you have one C-section, you end up having another. And this is what the C-section would be. This would be a transverse incision from basically part of the one side hip to the next side, and then they'll reach in, pull everything, and then bring the baby out. And then there's also, they can do it vertically, and that's where they go straight up, but that's old-fashioned, and most doctors don't do that unless it's a really big emergency anymore. Now they try to keep a nice little line that you can cover with a bikini, so keeps everything so the woman doesn't feel like, she's got a big scar. Well, like I said, if you got that big scar, that's because there was a big emergency and they needed to get your baby out to save the baby. We're going to talk about birth control because sometimes it's not the right time to have a baby. So we have the option to either use different contraceptives or abstain. Abstain means that you don't participate in sex. So that is the 100% guaranteed you are not going to get pregnant if you are abstinent or abstain from sex. That is the only 100% way. Now, there are many different ways of contraceptive condoms, and if used properly, they got a pretty good success rate, 90-95%, right? Then there's birth control, and it's about a 99%. And except for with Sarah, and the doctor forgot I was young and didn't tell me that the antibiotics I was on for a sinus infection would decrease, and the steroid that would decrease the effects of my birth control pill. Oops. So that's something a lot of women were like, well, I was on birth control, I never missed a day. Surprise. Antibiotics and steroids certain medicines can decrease the effectiveness. We have other forms like, and I know everybody always talks trash about Depo-Provera, the shot. I think it's amazing. It is a wonderful option, and for me, it was excellent because I barely bled after I had it. I'd go in every 3 months. I noticed, I might gain a little weight, but I just, at the time, increased my activity, so I didn't have any problems with it. It's very convenient. Most of the time, insurance does cover it. And the worst case scenario, if they don't, it's $100. And it's good for 3 months. And, there's no baby time. So it's a easy, convenient way. The diaphragm is like a little silicone cup. And I've never understood these. Now, I know I have a friend that's what she's used. But I guess it's sort of like the Diva, I don't know, like the Diva cups like this. It prevents a barrier or but they are safe, they are effective, and usually if you have one fit for you, it's good to about 2 years. And this is showing you the different things, the pill, Depo-Provera, and the diaphragms. And each one, they have to be fitted for you, the diaphragms do, and they do that at your doctor. The next thing we're going to talk about is infertility. And the definition that you need to know for infertility is if a man and a woman have been, or a woman and a woman from, no, it would have to be a man and a woman. So if a man and a woman were trying to have sexual intercourse unprotected for a solid 12 months and they couldn't conceive, that would be clinical infertility. Now, there's cases of same-sex couples and they can have infertility, but it usually takes them a lot longer to figure it out, like a woman, or um, uh, because what ends up happening is they're going in and they're having implantation and they don't know if the implantation failed or if it's the fact that the woman herself is infertile. So usually what they'll do to prevent that is they'll do a lot of pre-testing for those couples. But infertility is an emotional thing, and that's why you should avoid your patients if they come in and say, "Oh, do you ever plan on having children?" You don't ask questions like that, or you don't ever. That's why another reason we never say, we never go in and tell our patient that their pregnancy test was positive. And one of the reasons we don't do that is because A, we're not the doctor and we don't diagnose, and then B, a lot of times those hormones can show up after a miscarriage or an abortion or by accident. So it's something you really wouldn't want to get somebody's hopes up and tell them or have them worry one way or the other. So like I said, never do that. Never, even though you're usually the first person to find out, we don't say nothing. We let the doctor tell the patient that. And then we're going to talk about the two different infertilities, and then we're going to end lecture. Primary infertility is when a woman's never had a child. So that's basically means she has never been able to carry a pregnancy to a live birth. Okay, that's primary. So now she may have carried the baby, but the baby was stillborn. She never had a live birth. That's primary infertility. Secondary is when a woman has had a baby and the baby lived and was a viable baby. It was alive at the time of birth. Might have passed later, but that doesn't count as infertility. But what ends up happening with secondary infertility is after that first birth of a live birth, then they have trouble afterwards conceiving again, and that's called secondary infertility. All right, I hope that makes sense. Causes of this, so many different reasons: ovulation or disorders, uterine disorders, cervical disorders, shape of it, fallopian tube damage, inflammation, sexually transmitted diseases, early menopause. Sometimes women find that they're so worried about wanting to become pregnant that their stress is what's causing their infertility. So there's many, many, many different reasons. For men, sometimes it's not the woman, it's the man. And that's usually because he has abnormal sperm or a lack of sperm. Now, something that can happen because of genetic, diabetes, mumps, trauma, certain toxins and chemicals, and radiation treatment and chemo. So there's many different things that can cause infertility in a man as well. All right, we're going to stop here for today. Anybody have any questions? Nope. All right, well, thank you for joining me on lecture, and I'll be posting some more additional things in Teams for you to take a look at, and make sure everybody hangs up on so I can download. Have a good day, guys. Survey monkeys if you haven't done them. Thank you.